Okay, so that ship arrives today. This press conference was on Wednesday. Now, 18 residents of the Upper West region have so far been killed by meningitis outbreak there, but it appears little national attention is being given to it because we're dealing with, obviously, the coronavirus. Upper West Regional Health Director Dr. Sei Kufuor Afre says this is worrying. The late reporting of the cases in health facilities in the region is compounding the problem. Let's listen to him.
Dealing with CSM. Okay, we are dealing with cases of meningitis. And looking at the environmental conditions that we find in the Upper West region, around this time of the year, it's dry, it's very hazy and dusty, and also the temperatures are very high. As at yesterday, temperature was around 45 degrees. So these environmental conditions predisposes the people here to getting meningitis. So as at this year, from the 1st of January to last Friday, we've recorded quite a number of cases, about 137 cases. Compared to last year, it looks better. Last year, by this time, we have recorded more than 180 cases. Now, we recorded about 137, meaning the figures are coming down. But it's still high because we really don't want people to be getting such diseases. And we've recorded also some deaths, which is not very good because we expect that once people are diseased, obviously, they should be healed. And if we have treatment protocol for a disease, we don't understand why people should die out of the disease which we have medicines to treat.
How many deaths so far?
So far we've recorded about 18 deaths, which is quite high. It's quite high because once we have a treatment plan and all the measures put in place to manage meningitis, from health education to case management, we don't expect people to die, most especially when every year around this season we get cases of meningitis. But our little analysis showed that the deaths didn't occur within the same period, but at least some weeks we get 2 deaths, some weeks we get 3 deaths recorded from different districts. So that is a challenge. We also realize that most of the people who died reported to the health facility very late. Some were even brought to us unconscious. Some, terminally ill. They virtually could not even eat, and we needed to make sure we stepped up our game to make sure they survived. But unfortunately, because they came in late, it was very, very difficult for us to revive them. Most of them are adults, and some also had underlying diseases, and like HIV, TB. So once they get these comorbidities, then it also put them at high risk of dying. But we've identified this and we have activated all our systems. But the biggest challenge from our analysis or social mobilization activities is that because the whole country is singing COVID-19, coronavirus disease, so people's attention have been diverted from meningitis, which is even more virulent than the COVID-19 we are talking about. So it seems the precautionary measures and people attending the facilities have been on the downside, and people rather are looking for hand sanitizers and others, which is very good because the whole country is in this state. So we all have to create awareness. But underneath the COVID for us is the meningitis that we are doing. So we are engaging the media, doing a lot of public outcry, organizing debates, and advising people about the signs and symptoms that will show for them to know that they are having this. So it all comes back to the fact that once you find something unusual or you are sick, at least go to the health facility for them to check what is wrong with you. But once people start self-medicating, they use herbal concoctions and they stay in the house, then it creates a lot of problem for the case management. Because if you don't get the cases on time, like I said previously, if they come late, then their chances of survival becomes slimmer than it would have been.
With the mortality figures, do you envisage more be recorded or it can reduce? Looking at all the interventions you put in place and...
Now that from week four, that's from almost ending of January, when we started recording the cases, we've been creating a lot of opportunity for health education, go on the radio, the debes. We've sent information to the community of nurses so that when they do their home visits, they talk to people about this. The main challenge has been the late reporting to their facilities. So we are hoping that as we have intensified health education, people who are sick will not stay home for long, but at least they will come into contact with the health system at their environment so that quickly we can do the diagnosis, identify what disease they are having, and then we can move on to the treatment protocols, what we have.
You're still watching News Desk here on Joy News. We've got still more news to come. Stay with us.